I think the biggest thing is just lack of education for a lot that come in. And sadly, like medicine, a lot of dental offices are seeing multiple patients at once and chasing kind of seeing more instead of focusing on fewer. And our philosophy is to one-on-one attention and to therefore then be able to have time to educate patients, to help them understand what we see, but why we're concerned and what their level of concern is, and then make a game plan that makes sense to them to treat whatever we might be concerned with. Because they learn along the way, and then they become a little more willing to do more things at home to help themselves because they start to realize the importance of how it impacts their whole body. Disease doesn't know any age, so disease can happen in the young, particularly gums or cavities. But definitely as we age, I think the biggest thing is we don't fight things off as well. We don't fight away bacteria, or bacteria takes a hold of us more, or sometimes medicines that we have to take can have side effects of dry mouth or things like that definitely impact how well bacteria flows, meaning more cavities or gum problems, things like that. So it's important from the get-go, and I think the best habits are always formed the younger you are, and we carry good and bad ones throughout our life. That's what I would say is education, and that, yeah, it does change, but disease does not know any age, and I think it's important throughout life in order to maintain health and keep all the teeth that we want. First, like on their entry forms to the practice, there's questions about that where they can write it down instead of maybe to say it out loud. That allows me then to ask better questions of what their concerns are, or how they feel about their smile, or what would they change if they could change anything, and get them talking. And then our goal is then to listen to that, and then from there offer potential solutions or offer potential options that could have a major impact, because most people, they don't necessarily like to talk about it, but most people will do things like cover their teeth with their lips or their hands, or other things that change like their appearance, change like how the world sees them, all trying to hide maybe underlying things they're concerned about, but maybe afraid to ask. So I think it's really just getting them talking and what do they think about things, and then from there we can decide on how we might be able to help.